Hello, everybody. We have with us Dr. Roma Kumar, Chief Psychologist of Emotionally. And we are going to talk today about a new emotional disorder which seems to have affected a lot of people in COVID times. This is called an adjustment disorder. And let me start by asking Dr. Kumar, what exactly is an adjustment disorder?
Well, when a stressful event in someone's life prompts a very lengthy and an extremely or an excessively negative reaction, that person can be considered to be suffering from, situations of adjustment, or if you want to label it as an adjustment disorder, which is typically where the person has a lot of anxiety, difficulty moving forward, and there's also behavior which may be very, very reckless.
What should people do? And how would they recognize by itself if they have an adjustment disorder?
It's you start seeing a little bit of different behavior. That means development of emotional or behavioral symptoms in response to a stressor, which is you can identify that stressor. And it should be there for a period of at least 3 to 4 months to be able to get labeled as a disorder. And this is also leading to a lot of distress, marked distress, which is out of proportion, and you start feeling very dysfunctional and you're not able to function properly. And there's a significant impairment in your social behavior, your occupational behavior, or other important areas of your functioning. So that's when you see that the person is actually having problems with adjustment.
And should a person who feels that he or she is having an adjustment problem, should they see a psychologist?
Well, the primary goal of treatment to something to do with adjustment disorder is to relieve the symptoms and to help the individual achieve a level of functioning which is comparable to what they demonstrated prior to that stressful event. So we need to work on how the person reacts to that stress, especially if we talk of the COVID times, which include economic conditions as well as, support systems or the social support which has been missing, or the occupational and recreational opportunities which got missing. So the recommended treatments usually are psychotherapy, or it could be family therapy, behavior therapy, and of course we have self-help groups. But primarily it is to understand that the stress has led the person to something like this, and how is the person going to change that reactivity level, and that's where psychotherapy actually helps.
Thank you so much, Dr. Kumar. I'm sure everybody who's heard this or viewed this have found it quite useful. Do take care, look out for signs on adjustment disorder, and if you are looking like you're suffering from it, we are always here, Dr. Kumar and a team of specialists to help you. Do let us know if we can help in any way. Thank you again.